Hello, everyone, and thank you for viewing my rebuttal presentation for the opponent's argument that a national prescription plan not be made available to all Canadians. To begin, I'd like to thank my debate partner for providing an interesting and well-developed argument that is in favor of that issue. In this rebuttal video, I will address claims made by the affirmative side, illustrate weaknesses within the arguments presented, and add further credible information that confirms a national prescription drug plan is not in the best interest of all Canadians, using three critical talking points illustrated here. As noted in my opening statement, accessibility of drugs continues to be an issue for Canadians. The affirmative side has argued that accessibility to prescription medications would improve with the National Prescription Drug Plan in Canada. According to the Canadian Journal of Hospital Pharmacy, a universal pharmacare plan would use one central drug formulary. This might restrict coverage currently granted to Canadians through provincial drug plans and private insurance. As previously noted in my opening argument, special interest groups such as the Canadian Organization for Rare Disorders are concerned that a single national drug formulary would be limited in its ability to provide for those patients. It is estimated that 1 in 12 Canadians, approximately 2/3 of which are children, live with a rare disease, which is costly for patients and families. This creates considerable uncertainty for this demographic and highlights the gap in care that currently exists. According to Rawson and Adams, conflicting political platforms continue to impact those with rare disorders requiring prescription drug coverage. For example, the authors note that the work done by previous governments was removed and dismantled after the elections in 2018. Therefore, Canadians, and particularly those with rare diseases and chronic conditions, are left wondering if they can count on a federally managed national prescription drug plan. Also previously addressed, who will decide what drugs are included in a national formulary? Who will oversee the provision of a national prescription drug plan? The affirmative side claims that a national prescription drug plan will provide savings for Canadians. Canadians can gain insight and learn from national prescription drug plans that currently exist in the UK, Australia, and New Zealand. Given that these countries also have national prescription coverage and Medicare like ours, findings can be generalized to their population. To meet the population's medication needs, these countries engage in a process termed sole tendering and bulk prescription purchasing. Sole tendering is the practice by which a lone purchaser buys supplies at a cost or lower prices than would be provided individually. In the case of prescription medication, sole tendering places government organizations at an advantage, as they can negotiate a lower price for a larger stock. However, this purchasing practice also comes with significant spin-offs to the patients, healthcare resources, and businesses. As stated by Acri and Liebecker, sole tendering policies may result in limited access to medications, reduced medication supplies, worsening health outcomes, restricted choice, and a stifling of innovation. Reference-based pricing is another buying tactic used by the government in the provision of pharmacare. Reference-based pricing amounts to clustering drugs according to some equivalence criteria and establishing a reference price for each cluster. Similarly, therapeutic substitution can pit medication efficacy against cost and value. This could compromise the quality of prescriptions if costs are a factor. Therapeutic substitutions describe the process of interchanging medications that are chemically similar. This is often observed for generic and brand name drugs. However, therapeutic substitutions are not always the best choice and can end up costing patients more in the long run. To highlight the dangers of choosing cost over quality, the province of British Columbia implemented a mandatory therapeutic substitution of a proton pump inhibitor, also known as a PPI, medication, and it's commonly used to treat gastroesophageal regurgitation disorder, and this was chosen in favor of a generic equivalent in 2003. A study by Skinner et al. Found that the substitution cost $43.5 million for hospitalization, physician care, and medications. This case illustrates the dangers of choosing cost or over quality in our healthcare system. It is also demonstrated that poor prescribing habits can lead to underuse, inappropriate use, and misuse of medication. Denying patients brand name drugs can lead to costly hospitalizations. In summary, there is considerable evidence supporting the opponent's claim that a national prescription drug plan should not be available for all Canadians. On the surface, a universal pharmacare plan appeals to the virtuous who view this as the solution to our healthcare woes. Both the affirmative and the opponent side of this debate agree that the current state of pharmacare in our country is not adequate and requires robust revision, planning, and delivery. The prospect of overhauling the current system for Canadians who receive support from provincial governments and have private insurance is daunting. To provide coverage to more people, certain groups of Canadians, particularly those with complex health challenges, may find themselves in a precarious situation and left to pay for costly medications not on the national formulary. The process of finding cost-effective solutions in the pharmaceutical world convolutes an important aspect of healthcare, which is quality. Lessons learned in British Columbia demonstrate that $1 saved can be $2 or more spent. Prescribers should be motivated to ensure that patients receive the right drug despite cheaper options. As the saying goes, you get what you pay for. You, the audience, must decide if a national prescription drug plan can guarantee quality and savings. Thank you for listening to my rebuttal and considering the opponent's side of this debate. I look forward to hearing your feedback. Hello, everyone, and thank you for